What are you supposed to be?
I'm an unfinished course of antibiotics and I can lead to antibiotic resistance. Aren't I terrifying?
How's that scary? You know what's scary? He is.
You have no idea what antibiotic resistance can do you? In 1940, Albert Alexander got a scratch on his face when he was pruning roses. It then got badly infected, and his whole head was swollen with abscesses, and his eye had to be taken out. Before antibiotics, dying from a simple infection was pretty common.
So what happens when antibiotic resistance renders antibiotics useless?
Well, we will still recover normally from the bacterial infections that our immune system can fight off. But for some bacteria like Mycobacterium tuberculosis, Salmonella, or MRSA, a simple infection can kill as our immune system are defenseless against them and we have to rely on antibiotics. However, currently, these bacteria are already resistant to most antibiotics available.
Then what does this mean for us?
This means that there will be no way to protect people with weaker immune systems like babies, elderlies, HIV patients, and organ transplant patients. Treatment that requires the suppression of our immune systems, for example, organ transplantation, or those that results in the weakening of it, for example, chemotherapy, would make patients especially vulnerable to infections and thus be fatal. This means that surgery will have especially high risk of infection and higher mortality rates. Any medical procedure that requires introducing foreign substances into the body cannot be carried out. No surgical implants as they may have bacterial biofilm, no intensive care as IV drips can deliver bacteria, not even kidney dialysis can be carried out as fluid entering the bacteria may result in bacterial infections. In fact, antibiotic resistance is impacting us right now. Because of the irresponsible use by the lifestyle and medical industry, antibiotic resistance has become one of the most pressing issues in society. Resistant pathogens lead to higher healthcare costs and require stronger drugs to treat, leading to more adverse effects. For example, the use of colistium for highly resistant Pseudomonas infection is associated with a high risk of renal dysfunction. Some people think that antibiotic resistance is not a pressing issue as there are other alternatives like antibodies, bacteriophage, and AMPs. Let's ask Dr. Moon about them.
Okay, so AMPs, even though they are actually considered potential alternatives to antibiotics, but then there are of course challenges that you need to overcome if we can use them as alternatives to antibiotics. For example, they are not very stable in blood circulation system. They're sensitive to protease degradations. That's something they have to work on it. Then on top of it, cost of production is higher as compared to antibiotics. Yeah. There's one more thing about toxicity issues that you have to get that resolved before you can use it in.
As you can see, these alternatives are not ready to replace antibiotics yet, and we still need to rely on antibiotics heavily. Accepting his Nobel Prize in 1945, Sir Alexander Fleming said, "There is a danger that the ignorant man may easily underdose himself and expose his microbes to non-lethal quantities of the drug to make them resistant."
Wow, I guess antibiotic resistance is scary.